Big breath in. Breathe in and out. When you breathe in through your nose. Breathe in. And as you exhale, blow it out. Walk forward and back for 4. Forward and tap. Back and tap. Good. Little step. Walk forward again and tap. And heels. Now keep those heels. Reach up. And again. March. 4 to go. Left leg back in. Okay, march it out. I'm going to have a little stretch through the legs first. Take that right foot back.
It is my honor to be invited today to celebrate with you World Diabetes Day. May I share with you the latest statistics on diabetes. According to the experts from the International Diabetes Federation, as of 2015, 415 million people in the world currently have diabetes mellitus, which translates to 1 in 11 adults. Kenembale na itukutuku ni bura-bura, chuka rota chukumbeka na vana nandrau chikalima na milioni na tamata i bura-bura tobira na matetaka na matenisuka. Of that, 46.5% are unaware of their status, which is equivalent to 1 in 2 adults. Rota chukumbeka ya basa kong bulu kaona na viva mana pasende na tamatea na iwiliwilea era singi kilani ra tobi rachugo na mate ni sukongo. 1 in 7 births are affected by gestational diabetes. E dua e na loma ni vitu na vasudu era tobi chuga na mate takingo. About 542,000 children have type 1 diabetes. E rota chuko e lima na drau wasa kabulu karu na dolo na ngone e ratobi mate nisuka. Every 6 seconds a person dies from diabetes related complications. Kena bale e rota chuka na on na sekondi en dona tamata e na mate chuka na mate ni sukongo na mate rerbakingo. In the Western Pacific region where we reside, 153 million people have diabetes, and this figure is projected to rise to 215 million by 2040. E rota chuka indonan rau 5.8 na milioni na tamata i bura-bura e tobira chuka na diabetes. Wambimbi na yatu Pasifika. Kenembale na rota chuka na yambaki ronondolu kavasa ngabulu e na vibe adoba chuga na runan rau kachini kalima na milioni. Over half of them have not been diagnosed and are at a higher risk of developing complications. Diabetes caused 1.9 million deaths in 2015. This is the highest mortality rate across all regions. Na materere bakengo e vabu na chuko na embaki saochi Runandolu kachini kalima ni baki in 2.2 na milioni na tamata eramate. 45% of these deaths were in people under the age of 60. Rote chuko e vasa bulu kalima na pasende wera na matengo e yadobira sange semberituni yadoba na baki ona sangabulu. In Fiji, 1980, the rate of diabetes mellitus was 10%. In 2002, from the National STEPS survey, the rate had increased to 16% by 2011. We have a diabetes rate of about 30%. Complications of diabetes have also increased. As some of you may have heard, the amputation rate now in Fiji is 1 in every 8 hours instead of 12.5 hours. Kene mbale, and I other chuga na musuni tikini yango, and a loman in dona tamata and a vei awalu na nawa, iviti manda. Also, according to the study carried out by our doctors at the Pacific Eye Institute, gona navalimbule ni mata isuba, and Baki Runandolu ka Chinikandua, diabetic eye complications was worst amongst those unaware that they had diabetes as opposed to those who have been confirmed with diabetes. Diabetes is strongly associated with lifestyle and behavior, and any effort to tackle diabetes must include a change in lifestyle and behavior. The government, through the Ministry of Health and Medical Services and its partners, has implemented the following strategies to tackle diabetes. Promote wellness in communities, settlements, municipalities, schools, faith-based organizations, workplaces, and sports. Trained community health workers to promote wellness and first aid. Offer screening services in all of its nursing stations and health centers for weight, blood, sugar, blood pressure, and screening of some cancers. Improving its special outpatient services in looking after registration of diabetes patients. Train foot care nurses to care for diabetes patients with foot wound infections and reduce amputations. Dotala na ito bulang indokai ko dabichugo o buniwai ni merike na no nataka chu na no ibiti na garabachu na matitaki ni suka na nonda langa. Increase taxes on alcohol, tobacco, and sugar-sweetened beverages. Kaya mbale me watumbuidake na isau ni na waibuso na tabako watakay na suka e na balay may mulia na matangali wainimoli. Improve specialist care at the main hospital for diabetes complications. The key to fight against diabetes is to promote a healthy lifestyle to prevent diabetes, treat diabetes, and prevent the complications of diabetes. 4 things need to happen. Create a wellness Waidina, that is, promoting thinking, breathing, eating, drinking, exercise, resting, and marital life. Create Waidina policies on stress management, tobacco, glue, marijuana, eating and drinking Waidina foods, exercising, resting, and reproducing. Be screened and visit your station once a year. You can invite and bring the nurse doctor to the village for the screening. Diabetics must attend clinics and take medications regularly. Be screened and visit your station once a year. You can invite a doctor to the village for screening. Lifestyle begins in pregnancy. We must place emphasis on the mothers of Waidina in nurturing their children and promote wellness behavior. I strongly believe that there should be no diabetes in Waidina. You have the land, great food, and the Waidina River. Feed the family first, and then bring the rest of Waidina produce to Suba. Wakanir na nomini Waidina, semberan yo kota na nomini yau na market kere Suba. I once again encourage you to make sure you and your loved ones have regular health screening, have a backyard garden so your family can eat more vegetables, spend quality time with your family, and look after your feet, especially if you are diabetic. And if sick, go to your nearest health center or nursing station as soon as possible. I would like to thank everyone for your participation today, especially the organizers. Thank you for acknowledging and creating awareness on diabetes. I would like to encourage everyone to take advantage of the services offered today to ensure a better productive and fulfilling life. In conclusion, I would like to say that partnership in Waidina is very important. The Vanua, Nalotu, must help fight diabetes in collaboration with the government officials of Naitisiri, the Rokotui, and the Provincial Administration Office. If we can work together, we can conquer diabetes.